Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. So today I'm going to talk about what is a sports chiropractor. So what differentiates a regular chiropractor from a sports chiropractor? And the truth is there's not really a technical distinction. It has more to do with the way that the physician practices. So I consider myself to be a sports chiropractor. Now that doesn't mean that I work exclusively with professional athletes or anything like that. It just means that I treat every patient as though they were an athlete, right? So I consider every person an athlete, whether you're a mom taking care of kids at home, whether you do CrossFit, whether you're a pickleball person, or whether you're a professional UFC fighter. I treat all of them like athletes. And so there's kind of four foundational pillars that I use in my practice and that other sports chiropractors use that sets us aside from the majority of chiropractors, particularly in South Florida. So most chiropractors focus on the adjustment, right? That's our meat and potatoes. So adjusting the spine. Most chiropractors do, cervical, thoracic, lumbar, pelvis adjusting. But what we do a little bit differently here is that we also adjust extremities. So we do shoulders, we do hip adjustments, we do ankle adjustments. I adjust a lot of wrists, sometimes do elbows, things like that. So for athletes that need to use their hands or their shoulders, these adjustments can really come in handy. So that's one of the things that we do that sets us apart is we do extremity adjusting. So of course we do the spine, but we also do other joints as well. And then occasionally other chiropractors will use these other tools, right? So we have our soft tissue work, modalities, and rehabilitation. What we do in our practice and what sports chiropractic is it's using all of these tools together. So depending upon the specific athlete or patient that we're working with, we'll use more of one of these things. So I have some people that come in and we're doing mostly rehabilitation, right? If it's someone that's post-surgery or if it's someone that just tore their hip labrum, we're doing a lot of rehabilitation. If you're a jiu-jitsu athlete that week after week is just getting banged up and you're coming in for recovery, we're probably focusing a little more on this side of things, right? So we're getting the spine aligned, we're working soft tissue, we're using modalities. So as far as soft tissue work goes, this I think is really what sets apart sports chiropractors, because a lot of other chiropractic offices that are maybe focused on higher volume or car accidents or workers' compensation probably aren't taking the time to do soft tissue work. So here at Miami Spine and Performance, we do active release technique, we do Graston technique, we do therapeutic cupping, we use hypervolt, Theragun, vibration massage. Pretty soon here we're going to be doing dry needling. So we use a lot of different manual therapy tools to help release the muscles. So most everybody that comes into the office, we're working some kind of muscular component. So a lot of times that'll be muscles around the hip, lateral quad, maybe up by the neck, upper traps, pecs. So we're using a variety of soft tissue tools to make sure that the muscle's functioning optimally and that you have good blood flow through your muscles, because a lot of times when we have a spine issue, the soft tissue will follow, and so we'll end up with a lot of stiffness in the soft tissue. We'll also use modalities, which some other practices do use. We use things like Normatec compression boots, so we use those for the legs and hips. We'll use the Venom, so that'll be vibration and heat. We use sometimes the electric stim, so we have a machine that has 11 different frequencies, so depending on if someone is pre-competition or post-competition or they're in the off-season, we'll use a different frequency, but we use the Compex unit, so we use a number of different modalities, and really what those are for is they're just to help complement the other therapies. So generally a modality is not going to be a primary therapy, but we might use it prior to an adjustment. We might use it at the end of a session to just kind of help the person relax. So we're a big fan of these and we use them when indicated. The last is going to be rehabilitation. So again, this is a major thing that separates us from most other chiropractors is that we actually do rehabilitation. So we do physical therapy exercises and everything like that. Here in the clinic, we also use a software where every patient of mine gets sent home with home exercises. So I have some patients that I'm just sending exercises through PhysiTrack. So maybe they'll come in with a hip complaint. We'll adjust the hip, we'll adjust the pelvis, we'll do some active release technique, we'll use the Normatec compression on the hips, and then I'll send them home with 2 or 3 exercises so that in between visits they can strengthen that hip or mobilize the hip, whatever it is they need. So we'll demonstrate the rehabilitation exercises here in the office, and then we'll send them home with that. The other thing we do with rehabilitation is sometimes I'll program it in as part of someone's workout. So I do have a lot of patients that get their workout programming from me. So I'm writing their training, right? So whether it's hypertrophy or if it's performance or if they have a specific sport they're training for, we'll design the weight training and conditioning around that sport or that goal, but then I'll also integrate rehabilitation based on what I know about their body specifically. So again, guys, we kind of use at Miami Spine and Performance, what you can expect is some combination of all these different tools. And again, that first visit, the reason why I spend a full hour one-on-one with every single new patient that comes in is because, number one, I want to get to know you. I want to understand what brings you into the office and how I can serve you. But number two, I need to figure out what are the right tools for this person. So there's no cookie cutter program here. Every single person is getting a completely unique experience to them. That's why, I spend more time with patients. That's why I use more tools, because we want the right tool for the right job. So again, Sports Chiropractic, if you're looking for a sports-based chiropractor here in Miami or here in Hollywood, Miami Spine and Performance, we're here to serve you. We have a bunch of great tools. We have a pretty good doctor as well, myself, Dr. Will. So I look forward to seeing you guys here in the office, and thank you for watching.